Hello and welcome to Anatomy and Physiology at Glen Oaks Community College. I'm Dr. Ren Hartung. For this video I wanted to talk about reflexes. What are reflexes? How are they important for your body and your day-to-day life? And then also how are they important in medicine in terms of a diagnostic tool? How are they important clinically? So that's what the subject is about today. First, what are reflexes? Reflexes are predictable, automatic. In other words, you're not doing them consciously. They just happen, so they're automatic. They are responses to stimuli. So very quick, automatic responses to stimuli. And how do they work? Here's the basic gist of how they work, and instead of drawing the neurons and stuff on the board, look in your textbook or go online for a reflex arc and it'll show you all the pictures. It does a better job than my artwork, I think. For a reflex to work, you need a few components. You need a sensor to sense the stimuli. Then you need an afferent neuron or afferent neuron. This is a neuron that takes that sensory information towards the central nervous system. That sensory neuron then needs to synapse with another neuron, and that is either going to be an interneuron, a neuron between the sensory neuron and the motor neuron, or it's going to synapse directly with the motor neuron. And by the way, in that little bit, talking about whether or not there is an interneuron present, that explains one of the terms that you may see, which is a bisynaptic response or a bisynaptic reflex arc or a monosynaptic reflex arc. If you think about it, if the sensory neuron has to communicate with an interneuron first, that's going to be one synaptic connection. And then if that interneuron then has to communicate with a motor neuron in order for the reflex to happen, that would make it a bisynaptic reflex arc. And of course, there are also multisynaptic reflex arcs that get more complicated. I'm going to try and keep it simple for this. Okay, so anyway, sorry, back to it. We need a sensor. We need an afferent neuron or sensory neuron. We then often will have an interneuron that then communicates with a motor neuron. And then the motor neuron will go out and innervate an effector, usually a muscle or a gland or the heart. So those are the components. I'll go through them one more time. Sensor, sensory neuron or afferent neuron to take the information to the CNS, possibly an association neuron, and then a motor neuron that goes out and innervates an effector that's going to make some kind of change that we will see as the response. Okay, why do we have these reflexes? We have different types of reflexes for different reasons, and they're all important. The first one I'll talk about are reflexes that help you stay standing. These are somatic reflexes, and that term somatic, by the way, means controlling skeletal muscle. The somatic nervous system controls all the skeletal muscle. So somatic reflexes are reflexes that are controlling skeletal muscles, and within somatic reflexes we have pain reflexes. This is the reflex that pulls your hand away from a hot candle or a burning stove or whatever. If you touch something hot, or if you get a pinprick, you hit a nail or a pin, it'll make your arm pull back. Those are somatic reflexes. And then there's also postural reflexes. Postural reflexes help to make sure that you stay standing even when you're not paying attention. And usually for my class I talk about one of them that I remember really well. I remember hanging out at a movie theater waiting in line for a movie, and I was standing the way I'm standing right now. I don't know if you can see my lower legs, but my left leg, my knee is locked. And knees are kind of cool. They can lock like that so that they allow you to stay standing without using lots of muscle power. So my left knee is locked, therefore my leg muscles are not very engaged right now. And I'm just standing here and I'm talking to one of my other friends. One of my buddies who's a joker is behind me and I don't know he's there. The friend comes up behind me, and you've probably seen this before, but he puts his knee behind my knee and really quickly pushes it forward to unlock it. Here's what happens when someone unlocks your knee when you're standing in this position. Your knee unlocks and your knee immediately starts to bend because, again, those muscles are not engaged. Here's how the reflex makes sure that you don't fall down. As soon as your knee unlocks, the quadricep group muscles in the front of your leg start to stretch quickly. That triggers sensors for that stretch and sensory neurons that fire and go up to your spinal cord. And those same sensory neurons that detected that stretch synapse with and stimulate motor neurons going down to the quadricep group and causes the quadricep group muscles to contract. And what you end up doing there is what the goofball was after, which is you do this little weird dance. You dance a little bit, but then your brain realizes what's happening and takes over the muscle, and you stay standing and you're okay. Think about what would happen if that reflex was not there. If your brain had to figure out what was happening before any action was taken, the knee would have started to buckle, and it would have continued to buckle, and before my brain knew what was happening, I could be on the ground, I might have hit my head on the table or something along those lines. So postural reflexes like these help us to stay standing without the need to engage conscious thought and higher brain function. They're there to protect us from falling over. Another fun one to talk about, I'm not sure, there's probably a more technical term for it, but I call it the falling reflex. If you trip on something and you're falling forward, there's a reflex that causes you to throw your hands up. You can find these kind of YouTube videos and stuff looking at this where people are just falling down. And it doesn't look fun, but it is kind of funny if you're in the right mood. That reflex works so that if we're going to go face first into the ground, at least our hands are there to take some of that trauma before our face and our head does. We're trying to protect the brain in that case. All right, so those are postural reflexes, and I talked about pain reflexes. Those are both somatic reflexes. I won't get any more complicated than that, I guess, for this. Autonomic reflexes. So I talked about somatic reflexes and some of them. Autonomic reflexes are involved with the autonomic nervous system, controlling things like heart rate, breathing, digestive function, and other, again, autonomic things that you don't have to consciously think about at all, they just happen. Autonomic reflex arcs are basically involved in negative feedback loops that help maintain homeostasis. My favorite example is the vasovagal reflex. And that basically involves, if your blood pressure drops, you have sensors in some of the arteries that lead up to your brain, specifically the aorta and the carotid arteries. They're called carotid bodies inside of the carotid, and they have pressure receptors. So if the pressure drops going to your brain, the blood pressure, then this reflex causes your heart to beat faster. Just to give you one example of an autonomic reflex. The components of the autonomic reflex arc, by the way, are slightly different. You still have to have a receptor. You still have to have a sensory neuron that takes that information up towards the CNS. And then you will have, almost always, you have an association neuron, as far as I know. And then you have a first motor neuron known as a preganglionic motor fiber or preganglionic fiber. And then you will have a second motor neuron in the pathway for autonomic reflexes. That second neuron is called the postganglionic neuron or the postganglionic fiber. That word ganglion comes in because the second neuron in that pathway has a cell body like all neurons do, but it's outside of the central nervous system. So it's housed in this bulge along a nerve, which we call a ganglion. The preganglionic neuron comes out of the central nervous system and it synapses with the postganglionic neuron inside of that ganglion. And then the postganglionic neuron runs out of the ganglion and it synapses with the effector, whatever that effector is. So again, autonomic reflexes are involved with maintaining homeostasis, and they're doing things that are unconscious to you. And again, somatic reflexes are reflexes that help you stay standing. Let me go back to the knee-jerk reflex, which was, by the way, what I was talking about when I talked about when your knee is locked and your buddy kicks it out from under you. In the doctor's office, in the clinic, the doctor or the nurse practitioner or whatever will have you sit on a table, kind of like I'm doing now. And in fact, let me move my camera so you can see my legs. So in the doctor's office, your nurse practitioner, physician, whoever it is, they'll have you sitting on the table like this, and they're asking you to let your legs just dangle. You're not trying to consciously control your legs at all. And they will then start the exam, at least for the knee-jerk reflex. They'll use a reflex hammer that looks something like this. If you're a child, they'll use a reflex hammer that's a little bit smaller. if they're serious about their neurological testing, they'll use this kind of hammer. There are different types. This one, by the way, had a pin up here that you could take out for testing whether somebody could feel being poked. And it's got a little brush in the base, which is used to brush on the skin and such to see if people can feel. So it's for more in-depth neurological testing than what we're going to talk about here. All right, I'm going to go back to my old school reflex hammer. What they'll do then is they'll make sure they can feel where your patella is, where your tibial tuberosity is, and therefore where the patellar tendon is that runs between the patella and the tibial tuberosity. And they may palpate on either side of that tendon just to make sure they got it localized. They're looking to see where they need to tap in order to get the reflex initiated. And then they will simply tap. And what you should see is a little bit of a kick of the lower leg, a little bit of extension at the lower leg. Boom. That would be a normal reflex. You should see a bit of a kick that calms down right away because the person's brain is communicating with these connections as well and keeping that reflex from going crazy, if that makes sense. In order for this knee-jerk reflex and for the other somatic reflexes to function properly, you can imagine that sensory neuron has to run through a nerve, a peripheral nerve, to go up to my spinal cord. The spinal cord, of course, has to be intact right there where the connections are. The motor neuron coming out has to run through the peripheral nerves and get down to the quadricep group. As long as all of that is hooked up, then the reflex will happen. If the reflex doesn't happen, if I'm tapping that patellar tendon and I don't see the reflex, then that might mean that the peripheral nerves are damaged, but it might mean other things, by the way. But if there's peripheral nerve damage, you're going to see problems with reflexes for sure. The other thing that this is used diagnostically for, specifically talking about the knee-jerk reflex, we talked about what happens if you don't see a reflex, but let me share with you one thing that it can mean if you see this kind of reflex. If I get the reflex to go, but then it jiggles around and doesn't calm down right away, or if it's just really hyperactive and the person's just kicking like crazy. Most often, by the way, it'll appear as a jiggling, persistent jiggling, and then calm down slowly. Here's what's happening there, or at least one of the possibilities. There's lots of possibilities, but if the person's spinal cord is severed or has a lesion in just the wrong place, then the brain can no longer communicate with that reflex arc and is unable to calm it down. So if the spinal cord has a lesion or has some kind of damage, then it's possible that the reflex will be hyperactive. And that would lead to the kind of thing that I showed you there with the jiggling or just the big kick. So that's reflexes, and it's a lot of stuff, I know. Let me put the camera back up. So yeah, that's reflexes as simply as I can put it to you. There are more complicated reflexes that are kind of cool. My favorite one is you've seen somebody walk across a gravel driveway in bare feet. If that gravel driveway has sharp rocks in it, then they're going to be doing this weird little dance as they cross the driveway, right? Part of that dance is because of reflexes involved with both pain and with keeping you standing upright, so somatic reflexes. Even though the person's consciously trying to get their feet to move across the driveway, they're having to fight against reflexes. And to give you an example of the reflex, if I step down with this foot, my right foot, onto sharp rocks, what the reflex basically does is it causes that foot to withdraw. It causes that leg to come up. At the exact same time, in order to help keep us standing posturally, it causes the other leg to push down to help maintain our weight, even though the right leg is coming up, the left leg pushes down. If there's sharp rocks on that side too, that's when we get that back and forth dance kind of thing going. It's just kind of weird. Okay, let's do some review. What are reflexes? At the bare bones basics, what are reflexes? And the answer to that is reflexes are predictable, repeatable, which is another way to say predictable, automatic responses to stimuli. Broadly, what are the two major categories of reflexes? Hint, one of them has to do with skeletal muscle and the other one doesn't. The answer to that one should have been a little bit easier, and that's the broad types of reflexes that deal with skeletal muscle are somatic reflexes. And then the other major category is autonomic reflexes that control smooth muscle, cardiac muscle, and glands. What else? Let's do, what are the types of somatic reflexes that we talked about today? And the answer to that is there are pain reflexes, and I'm not sure I spoke specifically about their function, but you should know it. Pain reflexes prevent further injury. If you felt pain, you probably got injured a little bit at least to begin with. So the pain reflex is helping to prevent you from getting more damaged than you already got to feel the pain. And pain reflexes are often also called withdrawal reflexes. When I've seen these tested in clinic, by the way, I've seen it in pediatrics when you have an unconscious child and they'll take their finger right where their fingernail is and they'll just start to pinch it. Just enough to cause a little bit of pain. And what you should see in the infant, if everything's functioning okay and they're at least semi-conscious, you should see the arm try to withdraw from that stimulus. And again, when you're cooking, you might experience pain reflexes because if you touch that hot stove, it's going to make your hand pull back, again, preventing further injury. And we could talk again, as I did when my friend kicked my knee out from under me, we could talk about what would happen if your conscious brain had to make that decision rather than the reflex doing it quickly. You'd probably have a bad burn by the time you figured out what was happening. What other questions? Oh, what are the components? What are the parts necessary for a reflex to function? And the answer to that is, for those components, you need to have a sensor, a sensory neuron, or an afferent fiber, it's also called, that takes that information from the sensor to the CNS. And then you may or may not have an association neuron, depending on the particular reflex. And then you absolutely must have a motor neuron that sends signals out to the effector in order to respond to the initial stimulus. Those are the major components. Those are the major components for a somatic reflex arc. How does the autonomic reflex arc differ from that? And the answer to that is the autonomic reflex arc has a receptor, it has a sensory neuron going to the CNS, has an association neuron, but then it's got two motor neurons. It's got two motor neurons. And there's a first motor neuron that comes out of the CNS and goes into a peripheral ganglion, either a sympathetic ganglia or a ganglia that's further away. And then a second motor neuron with a cell body inside of that ganglia that sends out a fiber to the actual effector. So that's how autonomic reflex arcs differ from somatic reflex arcs. All right, let's go back to, for autonomic reflex arcs, why do we have them? What's their function broadly? And the answer to that is, broadly speaking, autonomic reflex arcs are usually part of negative feedback loops that help to maintain homeostasis, like help keep the blood pumping properly. I always think about fluctuations in heart rate. But you could also think about vasodilation and constriction of arteries and things like that to help with cardiovascular function, controlling breathing rate, making it go up or down depending on the body's needs, controlling digestive functions, but they're all major housekeeping functions that help to maintain homeostasis. Let's go to somatic reflexes. What are they important for? And remember, we talked about two different categories, so you should be able to describe both of those. So what are somatic reflexes for? How do they function for us? And the answer to that is somatic reflexes There are pain reflexes, and their function is to prevent further injury. If we felt pain enough to trigger a reflex, there's an injury already, and now we're taking the limb out of the way of the pain in order to prevent further injury. The other one is postural reflexes, and those postural reflexes are there to help us stay upright, to keep us standing, to prevent us from falling down and hitting our head. Or as I talked about with the falling reflex where your arms pop up, to prevent damage even though you're falling anyway. There's nothing you can do about it at that point. What other questions can I ask? Oh, diagnostically in the clinic, I gave you an example of what the knee-jerk reflex looks like. How are these reflexes useful diagnostically? Let me be more specific. If a reflex is hypoactive, if I don't see it happening as much as it should, or if I don't see it happening at all, what might that mean about the peripheral nerves? And the answer to that is if I'm trying to trigger the reflex and I know I'm doing it the right way, but I don't see a reflex or I don't see a strong reflex, in terms of the peripheral nerves, that can mean there's a lesion or some kind of damage to the peripheral nerves. What if I see a hyperactive knee-jerk reflex? What might that mean? And here specifically we're talking about the spinal cord. If I see a hyperactive reflex, what might this mean in terms of the spinal cord? And why? And the answer to that is you have to keep in mind that in this case the job of the spinal cord is to take information up to the brain and bring information down to the brain, down from the brain, sorry. So if the reflex is happening and I'm just sitting on a table, I'm not falling or anything, and the reflex is happening, my brain should say, oh, dude, it's okay. We're not falling over. You can calm down. So it tends to calm that reflex, and we should see a normal reflex. That's what it means in terms of the spinal cord. If the spinal cord has a lesion or if it is damaged, then that calming signal might not come down to the area where the reflex is happening in the spine. So you wouldn't have the calming signals happening, and the reflex might be hyperactive. So to put it simply, if the reflex is hyperactive, it may indicate a lesion or some kind of damage to the spinal cord, which is bringing the information down to the brain to calm that reflex. Yeah. Trying to make sure we covered everything. Another autonomic reflex that you can play with at home. Oh, and I forgot to mention, I'm doing this video today especially because we're in the middle of COVID and all of my students are at home. A potential reflex hammer is a kind of, I guess, medium or small sized book, like a novel or something. And it works at least decently for being able to tap that patellar tendon. Or for my students, you can also use it to tap the Achilles tendon in order to trigger the ankle jerk reflex. But the other reflex that you can do at home just requires a flashlight. You can watch the pupils constrict when you flash a flashlight in your friend's eye, or into your own eye if you're looking into the mirror. In order to see the full effect of how this reflex is supposed to work, by the way, you should have your subject put their hand up here between their eyes so that if I'm flashing the flashlight over here, this eye can't see it at all. It doesn't receive that flash. And when you flash the flashlight into one eye, you should see this pupil constrict, and at the exact same time, you should see the other pupil constrict. This is why the doctor flashes the flashlight in your eye. They're looking to make sure that this particular reflex is intact. Okay, I think I've given you all I can about reflexes. As always, if I've made a mistake, please post down below and let me know, and I'll redo this video. And if you have any questions, please feel free to comment down below and let me know, and I'll get back to you as soon as I possibly can. Thank you for watching.